Kim with Spectrum Dermatology, and today we're going to be talking about some hormonal acne, which is a thing that comes up in my clinic pretty much every single day. You know, I've got lots and lots of female patients who are in the ages of 20 to 40 who, you know, may not have had acne earlier in life, but then really just start finding themselves struggling with this sort of jawline acne that's just persistently there. Okay, so Mallory, you've been having this acne for how long?
I've been dealing with it now since about 3 years now.
Okay, and so it started in your 20s, but
Definitely.
you know, when you were younger, you did not have acne.
Correct.
Which is really typical. People always say to me, why am I having this problem now when I didn't have it when I was a teenager? And so acne is not just a teenage problem. It's actually, for women, oftentimes a very long process. And we women, you know, our hormones are changing all the time. So when we're in our 20s and 30s, it's different than the teens. So you've got, you know, a significant portion that's on the jawline and fairly inflamed, which is typical. So, you know, a lot of people start with oral antibiotics, which you have to do for at least 3 months. And the problem is that when you come off the oral antibiotics, most people just flare right back up, and so they have to be on it for years, which is, you know, really not desirable. I find that a lot of people do well with either birth control, but many women, myself included, don't want to be on birth control forever. I mean, I think that's a fairly common sentiment because it's hard to remember to take that pill every day. There's another pill, and it's something called spironolactone, which is a anti-androgen. So it sort of blocks male-type hormone. Not that you have too much testosterone or anything like that, it's just that women, as we get older, our ratio sort of changes. We get a little bit less estrogen, a little bit more testosterone type hormone. So this one would block that type of hormone and therefore keep you really clear. And the great thing is it's not an antibiotic, so you don't get the yeast infections, the stomach aches, all of that. The only thing is sometimes people feel a little bit dizzy on the medication, but most of my young patients do really well. So that's probably where I would start because with the hormonal acne, what I find is women have it for years. I mean, it isn't just that they have it, you know, once a month or whatever. They have it for a long time. So that's probably where I would start with you, and we would get you started and just see how you do with it.
Perfect.
And maybe we can follow up with you in, you know, a couple months and see if you're better.
Definitely.